Welcome back, everyone. More than 37 million Americans are living with chronic kidney disease. To bring awareness to this issue, the National Kidney Foundation's Kidney Walk is happening across the country and even right here in Mishawaka today. Now, kidneys are important for normal, healthy functions, and that applies to our pets as well. But what do kidneys actually do, and how do we know if there's a problem with them? Our pet vet, Dr. David Visser, is here in the studio to share some of that information with us. How's it going this morning, Dr. David?
Very good. I'm glad we're talking about cats and dogs because I saw that cam shot and I thought it was a cat cam instead of an osprey cam. But in any case, kidneys are important. We have two kidneys ourselves, and dogs and cats both have two kidneys as well. You think that we're built exactly symmetrical, but it's interesting that one is just a little bit higher than the other one, but they function the same, and they're important. They have many different functions within the body. A lot of people know that they are there, but don't necessarily know what they do.
Yeah, so let's break down those main functions for cats and dogs, your area of expertise.
Yes.
Ospreys, you probably could talk about a little bit, but let's stick
kidneys too.
Exactly. Let's stick to the non, I guess, avian variety for now.
Sure.
So what are those functions?
So kidneys have many different functions. One of the main functions is that they have to get rid of the poisons, the toxins that build up in the body. So getting rid of those poisons is really important. They also have a job of keeping water in the body. So they do this in a way that keeps water inside while allowing the removal of water-soluble things. But it also has involvement in many different hormone functions. It manages blood pressure through a hormone system, but it also helps to manage red blood cell production through hormones that it makes. So it really is more than just getting rid of urine and getting rid of things that are dissolved in urine. There's a lot of different functions that it has that are beyond understanding of most people, even in vitamin D conversion into an active form too.
So what are some of the things that can cause kidney problems?
Well, kidneys, of course, are aging from the time that we start, and so all of us are just gradually decreasing our kidney function over time, but there are things that hasten that or can affect it in a more significant way. Lower urinary tract infections we talk a lot about, but there are also upper urinary tract infections, inflammation that can cause disturbance within the kidney's function itself. There's also toxins, of course. We talk about antifreeze being a toxin that can happen, but kidneys are involved in making urine very concentrated, and when minerals are in urine, then those minerals can coalesce into crystals and then develop into stones. So that's another issue that can happen. Most commonly in the bladder, but they can happen up in the kidney as well. There are different types of scarring and issues where there's microscopic changes within it, and kidneys, of course, are prone to developing a growth in the body like any other organ within the body, and so tumors can also develop. But it's important to realize that while they have a certain function, they can also have some microscopic changes that we might not even be able to see. We just see that there's evidence that there's some changes within the kidney function, but there sometimes is a need to look different or deeper to see if there's something more significant on a microscopic level there.
Yeah, I'm sure some of our human viewers can relate to some of those causes, especially kidney stones. No one likes to have to go through those.
Yes.
But what are some of the signs that people can look for in their pets to figure out whether or not they're dealing with some kidney issues?
This is important because they don't complain like we do, right? So we have to look for the subtle signs. So sometimes pain or discomfort can be the signs, but most of the time the first signs that pets show is that they're changing the amount that they're drinking and the amount of urine production. Most of the time these are increases in urine production, but to make up for all of that loss of water, they drink a lot to make up for it. But because the toxins can't be rid from the body, sometimes it will have sort of a nauseating effect as those toxins build up. That nausea can progress to decreasing appetite and maybe even stopping eating. So it's really important that we monitor for these subtle signs early on, because early intervention is the key to managing some of these conditions.
Yeah, and I presume there are plenty of tests out there to help diagnose kidney failure.
Right, yeah, there are. Blood work tells us an initial way as to what is going on with kidney function. Kidneys are kind of hard to feel in some pets, especially those that are what I describe as overconditioned. You might not be able to feel the kidneys all that clearly, but on a physical examination, we'll try and feel for the kidney size, shape, and whether there's any discomfort and palpation. But we usually need to do some blood work or some urine testing to make sure that we can corner what exactly is going on in the kidney. X-rays can be done to image the kidneys to see their overall size. Ultrasound actually looks through soft tissue structures to be able to see what the insides look like, if there's any changes with the symmetry, for instance. But sometimes microscopically, the only way we can find out is by taking a biopsy of the kidney, and that then hopefully can lead to a diagnosis, which then leads to a way in which we can manage or treat this.
Yeah. So we've talked about the signs, the causes, and the tests that people can do to see if there are these kidney issues. Now, what can be done once we know our pets have some kidney problems like this?
If there is a specific cause that's going on, we can treat that specifically. There's some infections where if we treat the infection, we can restore kidney function, get things back to normal. In other situations, there's been so much damage or there's an aging change that's resulting in scarring that all we can do is manage the kidney issues. If we decrease the amount of protein, which decreases the amount of urea that the liver makes, which decreases the amount of work the kidneys has to do, that's one change. If we manage these negative effects of having kidney disease by managing blood pressure or giving supplements to help with the red blood cell production issues, all of those kidney involvements can be managed. But this is a management thing sometimes rather than a cure thing. So we're trying to lengthen as much as is possible how we can restore and maintain our the kidney function we have remaining. The reason we can give a kidney to somebody else through donation is we don't even need 50% of our kidney function to function normally. In fact, blood work sometimes doesn't even show abnormal until 2/3 of kidney function is gone. But when that last 1/4 of total kidney function is all that's left, it's hard for that to maintain bodily function. So we want to make sure that we slow that progression as much as possible.
Yeah, definitely some signs we want to keep an eye out for. Thanks so much, Dr. Visser. And if you'd like to participate in today's National Kidney Foundation Kidney Walk, festivities begin at 9 a.m. at Central Park in Mishawaka. We'll have that link on our website after the show. And if you want to contact Dr. Visser, you can always reach him at 888-PETS-VETS, and you can always email him at michianapetvet@comcast.net. We'll be right back with more 16 News Now Saturday morning.